Since Viagra was first approved to treat impotence in 1998, tens of millions of men have taken ED drugs, including Cialis and Levitra. In 2015 alone, Pfizer reported $1.2 billion in revenue from Viagra. As with all medicine, there are potential risks, including rarely permanent blindness. The eye doctor who first uncovered the possible link tells us how he discovered it by listening to a patient more than a decade ago. And now new evidence suggests it could affect more men than first thought.
Viagra helps guys with ED get and keep an erection.
The patient used the drug shortly before wanting to initiate sex, actually didn't have sex, but noticed within an hour or less after taking the drug that he lost vision in one eye. And to me, that's something that's just beyond just circumstance.
Dr. Howard Pomerantz is a neuro-ophthalmologist and associate professor at the Hofstra Northwell School of Medicine in New York.
It's very serious, but at the time, at least the erectile dysfunction medicine had no such warning or hint of this.
Correct.
Pomerantz began to hear about similar cases, and in 2005 published reports of 14 patients who went blind shortly after taking Viagra. That's when I began investigating, and in May 2005 broke the news that the FDA was in serious talks with Pfizer to list blindness under possible risks. Less than 2 months later, labels on Viagra, Cialis, and Levitra added warnings about permanent loss of vision from blood flow block to the optic nerve.
Stop taking Viagra and call your doctor right away if you experience a sudden decrease or loss in vision or hearing.
At the time, the pharmaceutical industry put the warnings on the label, but insisted they really didn't think there was a link.
Correct, because this disease, ischemic optic neuropathy, has been associated with circulatory problems in the body, high blood pressure, diabetes, smoking, and other conditions. And it's sometimes difficult to separate those confounding factors that a lot of patients who have ED have already.
So the FDA asked the 3 manufacturers at the time to conduct a study to try to answer this question.
The FDA mandated that each of these 3 drug companies perform a prospective study.
In the decades since, only Pfizer has released its FDA-mandated study. Published in 2015, it confirmed the possible blindness connection. But Dr. Pomerantz says few ophthalmologists read about it.
So the Pfizer study, when it was finally released, found what sort of risk?
So they calculated approximately a 2-fold risk of developing ischemic optic neuropathy within a 24-hour period after using Viagra or one of the other similar ED drugs.
Over somebody that's not taking it.
Correct.
That's a significant risk in the medical world?
It is. I have patients who will ask me, what is my risk of developing this problem if I take one of these drugs? Now at least I can tell patients there's some research that shows that there is some significant risk of you developing this problem after you take the drug, if you're someone who has risk factors for developing this problem.
Pfizer updated its warning label to reflect its new study. We asked Pfizer if it's fair to say that its own study and label now indicate a link between Viagra and blindness. Pfizer pointed to the FDA-approved label, which says it's not possible to determine whether the cases of blindness are related directly to the drug or other factors. Pfizer also told us this issue is rare and that there's no scientific certainty with regard to the cause. But Dr. Pomerantz found the risks could be greater than the 40 cases of blindness he says Pfizer identified.
I did some research into the FDA Adverse Events Reporting Database and found that there are literally hundreds of cases that have been reported to the FDA of ischemic optic neuropathy related to ED drug use. I think it's vastly underreported.
Since it's eye specialists, not the doctors who prescribe Viagra, who are most likely to see patients with vision loss, Dr. Pomerantz got the word out to fellow ophthalmologists at a recent conference.
What was the response of your audience when you presented the numbers?
They were aghast because, again, the peer review literature only shows 40 cases or so. The fact that there are hundreds of cases out there that have been reported to the FDA I think just made people aware that, we just don't know how many cases of this are out there.
And to be clear, you're not saying that people shouldn't use ED drugs?
No, not at all. But I think people need to be aware that there's a potential risk to their vision if they use one of these drugs.
The makers of Levitra told us there's no conclusive evidence of a link. The makers of Cialis say blindness is very rare and its study is finished but not yet released.